Good afternoon, and thank you for joining us today in a live session by Medcare. Today's topic has been trending worldwide. The virus or the disease, thank God, did not hit the UAE or all different parts of the world. But again, since it's trending, we would love to hear from the experts about the black fungus disease. What's the symptoms, the treatment, and the causes of black fungus? Today, I would like to welcome Dr. Muhammad Jabr, consultant, ENT, head neck surgeon at Medcare Hospitals in Dubai, who will share with us valuable information around the topic and answer your questions through Instagram and Facebook. So I would like to encourage you all to start sending your questions and we'll be more than happy to answer them. Dr. Muhammad, thank you so much for being with us today and sharing some knowledge and information about black fungus. Again, as I mentioned, it's been trending worldwide. Alhamdulillah, it did not hit the UAE here, but it's always good to know what's happening, especially that it is related to COVID-19. So, Dr. Muhammad, what is black fungus?
Hi, good afternoon. Actually, the black fungus is a public term. It's actually a disease. In the medical term, we can call it mycorrhizomycosis. Actually, it's old infection. It's not new, but it's has been activated right now in the COVID-19 patients. So if we can tell that the black fungus is a fungal infection and it's caused by fungal spores. So what the meaning that? Meaning that we have spores of this fungus. It's all around us since long time, not new. It's in the air, in the trees, food, animals, in the soil. We can breathe it, but actually it's a very weak spores. Doesn't make any infection in the body unless some factors in the body, it will make it more strong and more causing infection in the body. So let's start that before COVID. Before COVID, we have this infection. It's called also the same name, black fungus. It's happening only in patients with compromised immunity. That's mean patient with healthy body without any comorbidities in the body. So the spores will enter the body, then live with it, nothing will happen. But if the patient with any other comorbidities like diabetes, like renal failure on dialysis, or he has some cancer, has been treating for this cancer by chemotherapy, radiotherapy. So all these factors, it will make the body immunity less. So the virus will see that this body is weak. So it will make some home in the body immune system to increase and more make some strong environment for him in the body to kill this body. So now, what's happened in the COVID-19? Maybe all people they will ask why now? Why it's happening now in the COVID-19? Why India? More the numbers of the COVID-19 with the black fungus. Actually, the black fungus, not the fungus, its color is black. Why it's named like that? Because this fungus infection make the tissue which is infected by this fungus to be in a black color. That means the infection will go to the body, will see that the body immunity down. Why the immunity down in the COVID-19? There is two major causes for that. COVID-19 patient, when they will be in, not in mild case, in the moderate or above, in severe cases, they will be either in long term of corticosteroid or in public term cortisone therapy, or they will be on long period of mechanical ventilation in the hospital or in the hospital for a long time. So the infection will see that this immunity is not good, so it will be aggravated. So actually the black fungus before COVID-19 like the patient with the diabetes. Any patient with diabetes, the fungus infection will be more. Why India? Now the number there, because India is the second largest country of diabetes in the worldwide. So already the India with a large number of diabetes in the world. So the black fungus is more there without taking care of the COVID-19. The black fungus there is already a high number. So now COVID-19 in India, high number, diabetes, high number. So both these risk factors make this black fungus to be also in high number. So now till this, about 1 week ago, so about 101 cases of black fungus in COVID-19 discovered worldwide. 80 cases of this 101 in India, 9 cases in USA, and about 3 cases in Iran. So now, if we compare COVID-19 with diabetes together in India, it's a huge number. It's 80% of them, they have a black fungus because of the diabetes, and about 60 to 65% COVID-19, they don't have diabetes, but they have a huge amount or huge dose of corticosteroids to treat them from the COVID complications. So if we summarize that the high level of glucose in the body, it will make the fungus to feed it, and it will make more advanced disease of this black fungus in the body. So if we can summarize that, what's the risk factors of this black fungus? We'll tell like that. Patient with a compromised immunity, diabetes, the most important risk factor, or is on a long term of corticosteroid or cortisone dose for treating. And these two issues, we found it too much numbers of COVID-19 like that.
Yeah.
Second one, patients with cancer, and we're giving him chemotherapy to fight this cancer, but also for the bad luck that this chemotherapy will fight the cancer, but it will fight the immunity system of the patient at the same time. So also the black fungus will found that it's a good environment to grow. Third one, that's the immune system of the patient with COVID-19, it will be low. The function of the white blood cells in the COVID-19 patient also it will be low. So it doesn't have the power to fight the COVID-19 at the same time. So, and fight the black fungus at the same time. Also, the black fungus will make the disease will be more. So now let's see that the patient now come COVID-19 in the hospital. How we can suspect that he has black fungus or not?
Yeah, Dr. Mohammed, so now we are covering the symptoms, correct?
Yeah.
So with a patient who's coming, first of all, just if we take it one step back, when would a patient know or feel that he has black fungus, right? So if we know the symptoms, is it different from any kind of flu? And again, is it visible by the eye? Like, is it a fungal disease that you can see on the skin, or it's something internally that hits the body? Just for us to understand how is it and the symptoms of it.
So if I can simplify it, so I will tell one scenario, it will be very common for the black fungus. Patient COVID-19, age 45, 50 years old, he's in the hospital for treating the COVID-19. He's on maybe in mechanical ventilation, or he's in the hospital only to treat this advanced disease. Maybe he will be diabetes, maybe not, but he's treating for the COVID-19. He starting to develop fever, nose blockage, swelling around the eye and in the nose, some discharge from one side, especially if this discharge will be like looks like black color. So at this moment, the doctor will tell please call the ENT doctor to have a look. So what's the cause of these symptoms? The ENT doctor will come to examine him. So he will look inside the nose by the endoscope. So he will find that there is a black tissue inside the nose. So this black tissue, if visible by another doctor, it will maybe looks like a old blood there collecting in the nose, but for the ENT doctor, the suspicion will be high. He will know that the patient has risk factor for this black fungus, and he will suspect that he has it. There is one important symptom with the patient. It will be very highlight the suspicion that the patient will have a very unpleasant smell. He will not catch it, but it will be more felt by those who is in contact with him. So if we collect all these symptoms with the COVID-19 patient, so the suspicion will be very high for the black fungus. So next step, the doctor will be in his mind that the early diagnosis and the early management, it will be the gold stone management for this patient.
Right.
So as you asked that, we cannot see the fungus by our eye, actually. So how we can diagnose this disease? So actually we have to do some investigation like MRI and CT scan, and also we'll take some piece of this tissue from the nose and send it for the laboratory to examine it under the microscope to see the spores of this fungus, so the diagnosis will be met.
Right.
There is one important question that maybe some patients will ask, doctor, my cousin, my relative has fungus and we are afraid to visit him in the hospital. We are afraid to catch this fungus by breathing, by the air room condition. Or I will tell them that this fungus spores, it will not be contagious from person to another
So it's
person.
not transmitted?
Not transmitted.
Okay.
So only transmitted by the, if this spores in the one surface soil, air or food, and we inhale it, so that time we can catch the disease.
Dr. Mohammed, now you said that for patients in the hospital who are already admitted with COVID or under observation in the hospital, can a patient who is having COVID-19 and they are quarantined at home get it? If yes, how would they know that it's moved or they caught black fungus and now they have to go to the hospital?
So as I said, that's who's the patient who they are not in the hospital. That's mean their case is in a mild case or non-symptomatic case. That's mean they don't have any symptoms. So for that we are keeping them in the outside the hospital.
Yes.
So for these patients, that's mean they don't have any risk factors. As we said, that's the risk factors for the COVID-19 with COVID. With the black fungus, it will be the diabetes or low immunity or something. Already, our guidelines that these kind of patients who have these risk factors, we have to keep our eyes on them or to keep them in the hospital.
Okay.
So these patients with COVID-19 and diabetes, they will have high glucose level, so they will be more risk and more prone to develop the COVID-19. But if they are in the home, for rare cases, if they develop any of these symptoms, fever, blocked nose, discharge from the nose, change in the vision, headache, or some bad smell caught by the other people, they have always ask their doctors that maybe they have this kind of infection, black fungus, and they have to consult their doctors. So after that, so we reached that we have suspicion of the black fungus. We did the MRI, we did the CT scan, we did the biopsy, and we see that they have black fungus. Here we have to move directly to the management. It will be very early management, so we can save the life of the patient. So the management actually is two parts in parallel together. That it will be surgical part and it will be also medical part.
There will be a surgical part.
Yeah, it's very important in the treatment.
Okay.
Actually, these two corners of the treatment, it will be under the umbrella of to correct the underlying cause of this COVID-19 with black. What the underlying is the patient immunity will be down. So we have to push the immunity up to fight to gain more soldier with us to fight this black fungus. What this soldier? It will be the immunity of the body itself.
But would this happen before going to surgery?
Yeah, in parallel. That's all together.
All together.
So if he has high level of sugar, we have to adjust that. If he is on a high dose of cortisone or corticosteroid to fight something in his body, we have to adjust this level.
Yes.
If he has white blood cell down, we have to increase it. All this one with the surgery and with the medical. We'll start by the medical. The medical, it will be antifungal medication. Antifungal medication, two kind of medication, will not go through in details about, but it's antifungal medication. It will be by the intravenous, by the IV, and the same time the patient will benefit too much from the surgery. What kind of surgery? By endoscopic materials. Will go through the nose. This here, I would like to mention that black fungus is 70%, it affects the nose and the sinuses. 60 to 70%, it will affect the nose, then eyes, then brain. So before this disease to be in advanced disease levels, we have to cut the tract of it. So how we'll do? We'll go through the nose. Everything, we will see it under this scope. In a black color, we have to remove it. Because if we remove everything and we one cell, small cell in a black color stay there, it will grow again and again. So we have to be very aggressive inside to remove everything dead and make all the tissue inside the nose and the sinuses to be in a fresh situation. And at the same time, I said that we'll give the patient some antifungal medication. Also here, we can do something that we can give the patient something is called hyperbaric oxygen. That means we'll give him some oxygen in high pressure. This oxygen, when we'll go to the tissue with the fungus, it will make the oxygen in this tissue, it will be more. So the fungus doesn't like the oxygen. So also it will help us to fight and kill this fungus in the tissue in the nose. Again, now I want to mention that the vaccination now, it's making the disease, it will be less. Will not say that the vaccine will prevent the COVID-19 to happen. It's making the COVID-19 infection to be in a very mild and slight disease in the patient. So when it will be mild, so we don't need to make the patient on high level of cortisone. Also, when it will be mild, it will not make that diabetes to be high level of cortisone. So at this level, so the black fungus will not find any environment inside the body to grow. So question, vaccine prevent the black fungus? It will not prevent, but it will avoid to reach the level that the patient will have the black fungus.
Doctor, now we know that the duration or the common time that given for COVID-19 patients is 14 days from the start of testing positive up until, so all in all 14 days. Patients who have black fungus, the duration of their infection, will it increase or stays within the window of 14 days?
It will actually make their immunity down, so it will increase actually. So it will affect this time, and actually the question now, that time it will be to fight this black fungus, because it will be more risk on the life of the patient more than the COVID-19 itself. Because at that time we need to go to a thorough and risky surgery for him, and also he will receive this antifungal medication. It will be also in high risk on his kidney and his heart at the same time.
And the duration of the treatment that you would put the patient of black fungus on?
Yeah, it depends on how much the patient will respond to this medication and for the surgery. Maybe the patient will go 1 time and 2 times and 3 times to the operation theater to clean his tissue inside the nose till we reach a healthy tissue, and also will adjust the concentration of the antifungal medication also according to his response to the medication.
Doctor, question, if now a COVID-19 patient caught black fungus and it was treated and we did the surgery, if God forbid the same patient caught COVID-19 again, is he at risk of catching or having black fungus once again?
Yes, of course, because when he catches the black fungus in the first time, that means he has some risk for that.
Yeah.
Either diabetes, either renal failure or anything. So if he got another time of this infection, so this infection of the COVID-19, it will also make his immunity to go low down again. So he is risk also to catch these spores of this fungus again. So he will be risk also to catch the black fungus again.
So what is the best way to look after the patients who are more prone to COVID and more prone to black fungus? What should they do? I know that you have mentioned the criteria and those who are more prone to COVID, but what can they do to avoid getting the situation worse and reach to a black fungus stage?
So I will advise them that who has diabetes to control his blood sugar always, and who has risk also has received chemotherapy, radiotherapy, or has any other risk to keep their eyes, and the doctors keep their eyes on them that they have these risk factors. And also I will advise them to get vaccine. The vaccine also as I mentioned, that it will not prevent the COVID-19 to happen, but it will make, if happen, it will make it in a very mild disease, so it will not affect the immunity too much. So the patient will be in safe side, not developing complicated diseases or the black fungus.
Dr. Mohammed, before we end our session today, stepping a little bit out of the black fungus, but still focusing on COVID and our immune system. What is the best way now to boost our immune system and keep it at a high level to protect us from catching viruses, including COVID, including black fungus, and other infections?
So I will advise all people to make the same guidelines. That's to wear the face mask always, to make the social distancing, and also to keep the controlling their risk factors, and also that will help the immune system. Also, the vaccination a lot. Alhamdulillah, here in our country, so the vaccination is going on, and we are more now percentage of citizens that got vaccinated. That it will help a lot. That inshallah will not get this disease, not this not this advanced complication of this COVID-19 in our country.
Dr. Muhammad, thank you so much for sharing this valuable information about black fungus. Thank you so much for joining us today. Our session was around black fungus. As mentioned, it's a worldwide topic and it's been trending. As the doctor mentioned, alhamdulillah, it did not reach our country here, but again, it's a good knowledge for us to know the symptoms. How can patients who have black fungus to treat it and get treated? How can we boost our immune system? And definitely the vaccine is helping a lot. So thank you so much for joining us today. Today we had Dr. Muhammad Jabr, consultant ENT, head neck surgeon at Medcare Hospitals in Dubai. Thank you for sharing your questions and thank you for your time. Until we see you in the next session. Take care.
Thank you.